All right, so I'm here with a patient success story, Deb Larson, and she's been gracious enough to talk to us about the success she's had with our joint renewal program. And so we want to welcome Deb. Deb, I think today, maybe just begin by telling us where your hip pain journey began.
Okay, about a year ago, I was having a lot of pain in my knee and in my hip. So I've had knee replacements. So I went to Dr. Lee because I was sure there was something wrong with my knee. And he assured me my knee was fine, but that I had osteoarthritis in my hip.
Right, so
And
you had already had the knee replaced.
Right.
And that's what you saw, so you're seeing him now for the hip.
Yeah.
And you wanted to make sure that knee was fine.
that's basically why I went.
Yeah.
And, you know, he told me that it wasn't bad enough for any surgery.
Right.
And sent me to the pain clinic.
Okay. And you did that here in Fort Dodge. And what were their recommendations for you?
Well, I went to the pain clinic in Humboldt because
Okay.
I could get in sooner.
Yep.
We started with a cortisone shot,
Okay.
and that gave me some relief for a while.
And about how long?
Well, probably 6 weeks to 2 months.
Okay. Well, that's not bad.
You know.
Okay.
And yeah, and then I started hurting again. And when it hurts, it was just such a sharp pain. It was hard to walk.
Yeah.
And I quit walking as far as exercise because I was afraid I wouldn't be able to get back home because it would hurt so bad. So I had another, not a cortisone shot, but it was another shot, and that helped for a few months. And then
Is it that kind of when you started to bring it up to me then? Or
I
something said-
did, and the day I came in for just my
Normal adjustment. Yeah.
adjustment, I saw that flyer in your office.
Right.
And it was like, oh.
Yeah. So it's so interesting. Deb has actually been a patient for quite a while and has been coming to get it adjusted. And to review, like your story is very common. Patients have some joint pain. They go see their orthopedist. And usually one of two things happens is it's either really bad and they got to rush to surgery, or they feel like they rushed to surgery, or they try to manage it before that. And you experience the cortisone shot, which we tell our patients a lot. Cortisone provides short-term relief, but ultimately long-term, we know it's kind of doing some damage to the joint. And you did get that short-term relief. And then what we can learn from that even is we've been offering this protocol for a couple of years, and you've been coming and didn't think of us, but now we did, and had the flyer in the right spot at the right time. But that's good.
Yeah.
So you saw the flyer, and obviously, one thing that was nice is that you trusted us.
Yes.
So when you saw the flyer, what was your initial thoughts? Or
My initial thought was, Josh, is this for real?
yeah, right, right.
Could I really get some long-term relief? And I didn't really want to have surgery.
Right, and you were beginning to think that was your option.
Yeah, I was thinking I have to wait till it's bad enough that I need surgery.
So again, you had the 2 injections. They were kind of giving you some relief, and even your surgeon was saying, it's even at that point, I know you're suffering, but it's not bad enough to do surgery yet. But you were not walking anymore like you typically liked to do, and it was starting to affect different areas of your life.
Yeah. And then, well, I met with everyone and went through what the process was. And when I started, I was really in a lot of pain.
Yeah, you were.
I was hobbling around. It was really, really bad.
So then when you saw the flyer, we talked about it, and we decided, hey, you know what, let's take a closer look. So I think we took our own x-rays here. Did we take our own? Yeah.
Yes,
we just took fresh
did.
x-rays while we were here. And then we got the process started. You elected to move forward. And if I remember right, as part of we have different protocols for different people, but with you, we began with the A2M injection was kind of the beginning. So that's the alpha-2 macroglobulin injection, which is probably a lot of people's least favorite part, because it is a lot of blood. We took 12 vials of blood, if you remember.
Yes, I do remember.
But I think you got pretty good pain relief pretty quickly after that.
I did.
And that's what a lot of patients will say.
Yeah. It was pretty much by the time I was ready to leave that day, I had some relief.
And that's not all the time, but a lot of our patients will get relief in that first couple of days. So that was awesome.
And that was the part I was
Yeah.
one thing I was very nervous about.
Sure.
Yeah.
Yeah.
was-
I mean, needles to get to the hip are
yeah.
long too.
Yeah.
Yeah. And then so that's kind of the first beginning part of the process. And then what do you remember about the process going through? What else did we do, or what did
Well, let's see. I had the supplements
Yep.
that you
the
gave
vitamins?
me
Yep.
and vitamins. Then we did laser
Yep.
treatments and the pulse
Pulse wave. Yep. That's exactly right.
wave. And then I started
Rehab care,
rehab.
the exercises. Mm-hmm. And were they too hard?
Oh, at the beginning it was
Yes.
extremely hard.
But was it neat to see your
lift your
progress?
leg, and
Yeah.
it was like, oh, it was so painful.
So, but it was interesting. You said at the beginning it was hard. So,
Yeah,
did they get easier? Yeah.
Oh yeah.
Yeah, that's
yeah.
great. So you got stronger and more
Yeah.
functional. And then we did end your protocol with the stem cell injection at the end.
Yes, I had that.
But at that point, even before the stem cell injection, you were like, I'm doing really
Yeah.
good.
Yeah.
I do remember that.
I really was. I was so pleased.
It's
By
great.
the end of rehab sessions,
And
I was
so we just had
feeling
it.
pretty good.
Even we had a little lag time there. I think we had like maybe 2 weeks between your last rehab and
Yeah,
the stem
before
cell.
stem cell.
Yeah, because we were still
Yeah.
letting the A2M kind of neutralize
Yeah.
things. What was the kind of the most amazing part through the process?
I think, well, the instant almost
Yeah,
instant
yeah.
pain relief,
Yeah.
and that I could walk without being so in pain.
Were you surprised that something that your orthopedist was recommending wasn't providing you the relief of something that you could get here?
I think at first I was skeptical,
Yeah, absolutely.
but then I really feel, and I do feel that big pharma kind of controls things,
Sure.
and I'm really, really thankful that there is a choice. Having a choice is really, really important, and knowing there's an alternative to surgery.
Yeah, I think our patients do appreciate that.
Yeah.
And I think a lot of them have that sentiment with you. So many times we talk to patients and they're just kind of frustrated with the different options they have. It feels like they're, not to, this probably won't be in the video, but like right now we're picking between two evils in our election process. But,
Yeah.
but sometimes in our healthcare, we're doing
That's
the same
right,
thing. We're kind of
right.
picking between two evils.
Yeah.
So patients feel like they have to choose between these two evils or don't feel really comfortable about the different options. And because of that system, the options we offer for people, because maybe their ortho didn't recommend it or potentially their insurance doesn't cover it, so they feel like maybe it's second-class product. And your experience has been quite different.
Yeah, really has. And one thing I will say, Dr. Miller at the pain clinic in Humboldt, and I told him I
Sure.
came to you,
Yeah.
and he was very supportive of that, and he said, that because my back, well, as you know, my
Right.
back gets really
Sure.
tight,
Yep.
and he said, make sure that you continue that, and that should help with your
process.
hip.
Yeah, and
So-
we find a lot of times the providers in the medical system have done research, and the providers in the medical system kind of know what could be better options, but even their hands are tied because they're
Right.
working in the system. And so a lot of times the
Yeah.
providers that we work with are very open to making a referral or supporting the decision anyway. So that's been a joy as well. So now we are, at this point, we're a couple of months after. How many months ago?
Well, it was August when I had my stem
so
cell.
so we're a couple months out of your
Mid-August, so-
procedure. How are you feeling today?
Really good.
Good.
I'm going to aqua aerobics. I go to gentle yoga, and I don't have pain there. I can tell when I don't do my exercises every
Sure.
day
Right.
that I need to, continue that stretching. But there isn't the pain.
You don't have that pinch at all,
No,
or
no.
that sharpness.
Once in a while, I'll have a little bit of pain, but nothing like it was before.
Awesome. That's
Yeah.
wonderful.
And again, I don't know how long this will last, but I'm hopeful.
Yeah, we are hopeful too. We think that it's going to last you quite a while because part of it is getting those motions back, getting the ability to move and function back, and so that we can live a healthier life as well. And so it's one thing that if we just gave you relief, but you weren't able to go do those things. But
Yeah,
patients like
yeah.
you that continue to stay active, we expect it to last you quite a while. So
Yeah.
if you were talking to someone, because we are, trying to make a decision whether to do this, kind of what would you say to them?
I would say that it's well worth the money, and if you're committed to it, yeah, it's well
Yeah.
worth
Awesome.
the commitment to it.
Mm-hmm.
Yeah.
Wonderful.
You know, I had looked into QC Kinetics in
Yeah,
Des Moines
yeah, sure,
because I
sure,
heard
yeah,
about it
of
on
course.
the radio.
Yeah.
And so I was really glad that you offered.
That we can do it locally, right? You don't have to
Local,
drive
yeah.
to Des Moines.
Yeah.
And I have also researched them, and I think they offer a good process. But from what I've seen, our entire plan, I think, is more comprehensive than theirs. I think they offer great injections and things, but I think our plan also helps us differentiate. But it also helps that it's local, and you don't have to drive down so
Yeah.
far and do it.
And I also appreciate, you know, there's anytime I feel like I need to go back to rehab, or I can always come back and,
Absolutely.
and get a
We're here to answer
refresher,
any questions and help out.
or
Yep.
any questions.
Absolutely.
Yeah.
Well, Deb, I appreciate your time. I appreciate you talking to anyone who might see this and encourage them. So thank you so much.
I would really encourage people
Thank you so much.
to do that.
So Deb is just one example of a success story. If you have any more questions, please let us know.